So at the ACLU, we have followed communicable diseases for a long time, back to the AIDS crisis and earlier. And we generally acknowledge, even though we are, hardcore civil libertarians, that when it comes to a communicable disease, at some level, individualism breaks down. We are one large biomass, and our civil liberties have to yield in a time of communicable diseases, and we're all seeing that now. I mean, we're all experiencing relatively drastic incursions on our civil liberties by being confined to our homes, and other such civil liberties. But our basic principle is that it has to be justified by science. For example, a couple of years ago, I and another ACLU person worked with the Yale School of Public Health and the Yale School of Law to write a paper on the Ebola quarantines. A lot of people who were working on the Ebola epidemic in Africa were coming back from being quarantined by Governor Stacey Hickox in New Jersey. Got national headlines. You may remember that name. And the thing is, with Ebola, the disease is not contagious until after symptoms begin, often well after. And that means that quarantining people, especially people who are medical professionals who understand what it looks like and know how to recognize when symptoms begin, is not scientifically justified. And if the quarantine is not scientifically justified, then it is a civil liberties violation. COVID obviously is different. It's contagious well before symptoms begin, it appears. And the whole country is locked down, and we at the ACLU, we fight for freedom, and we want everybody to be free again. And so we are bent towards supporting things that will bring about that freedom. At the same time, there have been a number of proposals that raise serious privacy issues, and so we've had to struggle with that balance. So I'm going to talk about 4 different issues that we've looked at and analyzed in differing degrees. The first one I want to talk about is something that I wrote a white paper on, which is location tracking. There have been proposals to use location tracking that is generated by our phones as an accidental byproduct of how our phones work. They always connect it to the nearest cell tower that contain GPS receivers, to use that data to help the pandemic. And there's a couple different ways that that's been proposed. The biggest sort of more sweeping concept is that everybody's locations are tracked. And then if you are identified as positive, then we cross-reference all your locations with everybody else's location and identify people that you had come into contact with, notify them that they are at risk of exposure. There are a number of problems with this. The biggest being that location data is simply not accurate enough for that. Location data is generated through cell tower sighting, GPS, and in some cases radio, Wi-Fi, and Bluetooth sighting. And it can be accurate enough to invade your privacy. It can be accurate enough to put you at the site of various political, religious, sexual, or medical establishments, for example, to put you near the site of crimes that you may be entirely innocent of, but nonetheless be suspected of, etc. But it's not nearly accurate enough to find out who has potentially been exposed with that 6-foot radius that the CDC has advised everybody on. And also, even if it was pinpoint accurate data, it would be very, very complicated to run algorithms or to analyze that data and produce reliable indicators of who may have been exposed. For example, you and I may be only 4 feet apart, but maybe we're in different apartments, or we're in cars, or you're a bank teller behind glass, and so forth. And Israel, which has, at least a month ago when I wrote this paper, was starting to deploy this kind of a system. There was a woman, for example, who waved to her quarantined boyfriend through a window and received an automated notice that she had to be quarantined because the algorithm had identified her as having been in contact with an infected person, when in fact she wasn't. So the other thing is the location data is fragmented among different cell carriers and different parties. A lot of this data also, in our view, shouldn't exist. A lot of the location data that's out there is being collected by very shady companies that basically make deals with the companies that put apps on your phone. So for example, let's say you use Shazam to identify music. Shazam does a deal with one of these companies. They track your location and they feed all your location data to this company, which then collects big databases of people's locations and uses it for marketing. In a world with good privacy protections, that data should not be collected because people have no meaningful knowledge or choice that it's being collected. At the same time, people say, well, the data has been collected, so we should use it. And that may be true to an extent, but we don't want, but what we are seeing is companies that have very shady practices trying to whitewash their reputations and legitimize their practices using COVID. So we have to keep that in mind as we assess the balance of positives and negatives here. Aggregate location data is another use. And that kind of aggregate data, and some of you may have seen, some of the graphics that have been put out about measuring different people's level of compliance based on travel amounts and so forth. And that can be completely legitimate. Ideally, the amount of data that's shared is the minimal amount of data. If Google has a cache of data about people's locations, they don't need to give that to the public health authorities. They can just give them the models, just the aggregate numbers. Another possible use for location data is to assist in contact tracing. And so this is what South Korea has done. If you test as positive, the authorities now, the legislature has granted the authorities the right to get your location history from your cell phone provider or other sources. And the Korean authorities then publish the locations where you were, and then everybody else looks at those locations and decides if they were at those locations when you were there. And it's become very sort of an everyday thing for people in Korea to check the listings of where infected people were. This is something that we could do in theory in a later stage in this illness. There's just too many cases right now, but if we were to get into a phase 2 where we were looking at long-term chronic low-level infections and trying to make sure that they don't turn into bigger infections again, this is the kind of thing that's been theorized. And in theory, it could be done in a way that doesn't invade too much privacy. Although in South Korea, the authorities have not done a good job anonymizing the data. One alert informed the public, for example, that, quote, 43-year-old man, resident of Nowon district, was at his work in Mapo district attending a sexual harassment class. And unsurprisingly, people have been able to identify who it is that's being talked about in these government alerts. But in theory, you could just list a bunch of locations all at once and times, and there could be something there. So, and then the final possible use for location data would be in enforcement. And basically as virtual ankle bracelets. So if you have been ordered to be quarantined, they could use your cell phone data as a way to try to make sure that you're not leaving your home. That could be effective to some extent if you're driving north on Interstate 91 and you're 15 miles from your house. It would be hard to hide that from your cell phone. On the other hand, again, the location data is very inaccurate. And so where cell phones have been used in the incarceration context and for as actually literally replacements for ankle bracelets, people are constantly getting alarms saying that they've left their home when they haven't, just because the cell phone pings and the connections to different towers is changing all the time. There's also a bigger concern here with enforcement, and this applies across all areas. Public health experts have generally cautioned that a law enforcement approach to combating disease is less effective than relying on voluntary measures and compliance. And this is because an enforcement approach often sparks counterproductive resistance and invasion and tends to sour the relationship between citizens and the government, and puts the government in an antagonistic position vis-a-vis patients, people who have every incentive to want to get identified if they are sick, who have every incentive not to spread a disease to their neighbors and their friends and their family. So good public health measures leverage people's own incentives to report disease and to help stop its spread. So the second of the 4 that I'm going to talk about is another set of proposals, which I think the location tracking proposals, at least in the United States, have been recognized as impractical in many ways for most purposes, except for maybe aggregate data. Another set of proposals is this idea of proximity tracking, which doesn't collect anybody's location data, but it does collect data on who you have been near. So this is based on cell phone Bluetooth signals, which have a very short range, relatively short range. And your phone is constantly sending out a ping and connecting with other nearby phones. You basically exchange, and this can be done in a privacy protecting way. You basically exchange the equivalent of like a raffle ticket where you split it in half and each of you takes one. They have the same number. And your phone stores up all those raffle tickets of different other people that you have connected with. And each time you connect with somebody, your phone sends out a different raffle ticket. And then if you test positive, your phone uploads to a cloud database all the raffle tickets that you collected over the previous about 2 weeks. Because anything before that, there's no reason to retain it. We want to minimize here. And then your phone also, if you're not infected, your phone checks that site and download all the raffle tickets to see if there's any matches with your phone. So there's a lot of questions about this approach and how practical it actually will be, and whether it will technologically work, whether it will swamp everybody with false positives and end up diverting resources from the core things that we know that we really need right now, which is contact tracing, social distancing, equipment for hospitals, and testing. Nothing should distract us from those 4 priorities that public health officials say is the main thing that we need to get free again. But in our white paper, we outline principles that we think any such scheme should meet to be done right. And there have been a bunch of different entities proposing and working on such schemes, including 2 European entities, MIT, and then most prominently, Google and Apple partnership, which is probably the one that would end up being adopted because of the market power of Google and Apple, obviously. But the principles include things such as it should be voluntary, should be non-punitive, should be built in consultation with public health professionals, so there's not a bunch of IT people who don't know what they're doing. That it should be privacy preserving. The data should stay local to devices where possible, based on unlinkable identifiers, not reliant or minimally reliant on centralized authorities, data minimization throughout, et cetera. That should be non-discriminatory, have a measurable impact, that there should be a way to shut it down, and it should be narrowly tailored to this specific epidemic. Because one of the big fears that reaches across all these proposals is that these things are going to be institutionalized and are going to outlast COVID. And so we can help with that by actually building into these kinds of technologies distinct ways of shutting them down, by anticipating that we will at some point have a vaccine. And I think in that respect, this civil liberties crisis is different from 9/11, because the threat of terrorism is something that never really ends, whereas we do know that COVID will come to an end.